Okay, welcome everyone. I'm Lauren Gates and your host of today's special edition of Airway Health Solutions Conversation Series with Dr. Scott Siegel and Dr. Richard Baxter. We may have some guests chime in here along the way. Welcome, gentlemen, and we are very grateful for you to take the time today to discuss your viewpoints on today's New York Times article that was released today. The title alone is very sensationalized. It's Inside the Booming Business of Cutting Babies' Tongues. So I know Dr. Moralia sent to me that this morning while I was having coffee. I almost spit it out just because of I could tell where this article was going to go. But I really just wanted to get your feedback and kind of review on how we can take something that may seem daunting and actually kind of go back on track to all the good that you both have done over the years. But before I do that, if you would allow me just to do a couple of disclaimers and a couple of formal introductions so people know your backgrounds, and then we can't wait to hear from you. So the views presented are the opinions of our speakers and are not necessarily affiliated with Lauren Gates and Associates and Airway Health Solutions. And the following information is provided for educational, informational purposes only and does not constitute providing medical advice or professional services. The information provided should not be used for diagnosing or treating a health problem or disease. And those seeking personal medical advice should consult with a licensed physician or dentist and always seek the advice of your doctor or other qualified health providers regarding a dental or a medical or dental condition. So let me, the pleasure today of introducing Dr. Scott Siegel. Dr. Scott Siegel is an oral and maxillofacial surgeon and pioneer of lip and tongue tie surgery, and Dr. Siegel's full scope OMS practices located in New York City and Huntington, Long Island. He's also the founder and medical director of the Center for Tethered Oral Tissues, including lip and tongue tie diagnosis and treatment, located in New York City. As the only teral oral tissue laser surgeon in New York City and Long Island, Dr. Siegel's surgical expertise and groundbreaking research and treatments on the association of aphasia, induced reflux, and lip and tongue tie in breastfeeding infants were recently published by the Journal of Pediatrics. And next we have Dr. Richard Baxter is a board-certified pediatric dentist, fellow of the AAPAD, and diplomat of the American Board of Laser Surgery. He's an internationally recognized speaker on tongue ties, instructor of the acclaimed online course Tongue Tied Academy, and lead author of the best-selling book Tongue Tied: How a Tiny String Under the Tongue Impacts Nursing, Speech, Feeding, and More. He is passionate about educating parents and healthcare providers and the effects that tongue tie can have throughout the lifespan. And Dr. Baxter, you were also had the tongue tie release and also treated your two correct with tongue tie revision.
Yep. All three of our girls. Yep.
Mm-hmm. Right. Wonderful. All right. So we got all that. I'm going to open the floor, Dr. Siegel, to you, because I know I was surprised over coffee this morning, and I know how you must have been as well when you read the article. Can you just give us a little bit of the background? Because I know you were interviewed by the New York Times. You want to just give us just to level set?
Yeah, so basically, I guess they've been going around for quite a while. I think just, interviewing people. My name was given out, I think, by Peter Vitruk, maybe even last year or something like that. Then they started interviewing a number of practitioners around the nation, and including New York, where they were based. And my name kept coming up, I guess, as somebody to speak to. So they had reached out. There were 3 reporters on the piece, and they represented the piece as what they were working on was basically a comprehensive, balanced piece to try to get some objective, points about what's going on in this area, because, the issue with tongue ties just keeps coming up, and I guess somebody brought it to their attention. So I guess the last person to direct them towards me was my, research partner, Kathy Jenna, who they spoke to and really kind of laid out research. And we were all about, I sat there, my first interview was about an hour with the 3 of the reporters. And I reviewed my history, what we're involved with research, and how this is evolving over the past, couple of decades. And, basically talking about those aspects. And then the aspect of, what it's like in private practice dealing with it. And then they asked at some point if they were able to even come into the office. And I certainly opened my doors widely. My feeling, with these things is try to be transparent. I didn't want to, because I had reached out to Bobby Gahary. I know he declined, didn't want to deal with it because he knew it was going to be a hit job off the bat. And maybe I was a little more naive in that area. And you do your best. The feeling I got from a lot of the people in the area is like, if you decline it and you're declining New York Times and they're right in this area, it seems like you have something to hide. And I certainly didn't have anything to hide. So I went in there naively being open, honest, and talking about research, talking about experience, and like the topic of this presentation, risk and benefit. And I had two journalists shadow me and a photographer to listen to me do consults, to speak to the families independent of me before and after without having that bias there, and to follow up with them for weeks afterwards to see how they were doing. So they neglected any of that really. And
that wasn't in the article. I didn't see that. I wonder why.
Yeah. So, and to talk about the positive results. And I said, very open and honest, we don't always get positive results. One of the areas that we're working on, especially in our ultrasound studies, was to try to see, are we missing something that we want to know is certainly when not to cut. And that's, what cases can we be doing differently that we treated maybe a few years ago one way, and we're constantly evolving. And I said, as in any field in medicine and surgery, we evolve. We evolve by doing research. We evolve by our experience. We evolve by attending conferences and having, educational resources like we are here. And, we don't practice in a bubble or a vacuum. But I said, there's a lot of controversy and confusion at this point. And one of our goals is to try to have clarification here.
Right. Maybe that's the positive that we can take out of this article, was the call to action to have, more supervised, guidelines, more publications, more.
100%. And that's how I view it. Is when you get over the initial shock and anger and emotions, and you start to look at the objective aspect of this, it's actually a very good platform. Maybe it'll sting our business a little bit, but it's also a good platform to be able to put it out there that we are coming together as a longer, a louder, stronger voice to get the research and come together so we can educate.
Right. And Dr. Baxter, I know you are the author of Tongue Tied. And in fact, on your book, there's like 118 references, so I don't need to put them all in the chat here, but I highly recommend people get this. What is your wish, if you would, on how to address this to patients who come in? Like, you're going to have patients, moms come in saying, hey, I just read this New York Times article. What is your opinion on that? What advice would you give to practitioners on how to respond to this article?
Yeah, it's a good question. I mean, I had treated 5 babies this morning, and I had just read it, so it was like fresh in my mind. And I was thinking, what, they're going to see this article later today or something, and maybe not. Honestly, as a quick aside, I mean, it's behind a paywall, and so you have to put your email in and sign up for the New York Times, which a lot of people don't have. So I think that's going to limit the reach of it. I debated posting something about it on our Facebook, but I was like, I don't want to draw more attention to this if I don't have to. So decided against that. I saw it is on Yahoo. You can read it on Yahoo without paying $1 or whatever to the New York Times, which at this point I want to give them a dime. But anyway, so I brought up to some patients and I just said, hey, like, there's this article that came out. It's a hit piece. They're slamming tongue ties and good providers like Scott here and others. And it's really sad that they missed an opportunity to really report honestly on it. Like you said, they told you it's going to be balanced, Scott, but they did not do that at all. They could have talked about, hey, this does help. And there's a couple lines like, oh, and they said it improved, and like really snuck in there so they can say it's quote balanced, but sadly it's fake news, like we've seen. And I think they've lost a lot of credibility the last 5 years with COVID reporting and other things that have turned out to be totally false or and not correct at all, or misinformation. And so I think that's part of how people will see this is like, I think it'll blow over in the next week or so. I think by Christmas it'll all be old news, but it's very similar to the Atlantic piece that made a big splash for a week or two, and then people moved on to something else. And so the news cycle is pretty short, thankfully. They've lost some credibility in the last few years. I think that helps. But yeah, if patients do bring it up, which I don't think many will, but if they do bring it up, you can just say, yeah, we always try our best to treat that patient as best we can. We never want to over-treat. We also don't want to under-treat. We try to get right on. And I tell patients, say, if I guarantee it'll work, then it definitely won't work.
Right.
So we hope and we pray for the best. And it's a process. Might have 1 better feed today, 2 better feeds tomorrow, but that means still 5 or 6 crummy feeds today. And like they could get dehydrated. That's an extreme example. They had to search all the way to Idaho and search around to find examples of where it's, gone wrong, so to speak. With, 100,000 being done a year. I don't know what the number is, but it's a lot.
It's a lot.
If you look at any other, surgery or procedure, it has way higher complication rates. And we'll get the money aspect. Dentistry is more profitable than tongue ties. Geez Louise, taking out thirds, Scott, would be more profitable for you than doing tongue ties.
Yep.
They act like you spend 5 minutes with them. I know that's not the case. If I spend 30 minutes with them and they're texting you, they're probably texting you right now. They text.
They missed that whole thing. They were in my office and they saw each patient was in my office for over an hour.
I know.
We have an IBCLC in the office and they're latching afterwards, and they were through the process, so they, as
$900, 5 minutes, like cha-ching, like what? That's not the case at all. But if they saw, they could just as easily write this article. I don't want to get too fired up, but they could just as easily write an article about oral surgeons, about endodontists, about pediatric dentists. The headline could be, rich dentists, fixing baby teeth that'll fall out anyway, just to build their offices bigger or whatever. They could do the same thing if they wanted to, because you can find a few people that are mad about their child's dental care. And the difference is, treating kids' teeth is mainstream. This is becoming more mainstream, especially in the last few years, but it's still, there's no oversight. What are you talking about? There's dental boards, medical boards, like the whole article, unfortunately, missed the mark. And they asked me to participate. My wife said, don't do it. I thought about it. I was like, look, I can set the record straight. I can, give them research. And she's like, do not do this. I said, okay. So happy wife, happy life. I did not, but I was going to, because I was kind of, like, hey, this is a big platform. And I've just been waiting for it to come out. It was about a month or so ago. They contacted me. I can't remember, but, and I talked to Sarush, Dr. Zaghi. He did an 1.5-hour Zoom with them, just like this. Laid out all the research, said it doesn't work every time, but here's what we're going for and here's what we're looking at. And they didn't use a single, not even 1 second of, an 1.5 hours he spent with them. So they just had an agenda from the beginning, unfortunately.
Yeah, that's exactly what I did with them. I laid out the same research Sarush did, and
So let's talk a little bit about the research for those. Right. Like what is your armor when you talk to parents? I think we had the 2 articles, research articles that we shared earlier. I'll put them in the chat, but you want to review the research a little bit, and then we'll talk a little bit about the risk-benefit ratio.
Yeah, Rich probably has a more concise listing of the research because of his book and whatnot, because he can.
It's really, all in there.
It's in there, and that's one of the things we direct them to as well, because you want a concise area to look at, research that supports what we do. It's in this book. But
I think there's 5 randomized control trials. It's like Berry 2012, Burrick 2011, Hogan 2005.
Correct.
Probably missing a couple just off the top of my head. And then Dr. Gahari's recently, and that really was helpful for posterior tongue tie, because in the article it talked about, well, it's just from this newsletter in the AAP from 2004, Kathy Watson Jenna, and they just suggested maybe it can help. But now we have actual data. And if you look at the hierarchy of evidence, New York Times articles is the lowest, it might be below the lowest level of evidence.
Yeah, no, it's true.
It's anecdotal. It was looking at a few patients, and it was, it's totally anecdotal. And they called some pediatricians. They said, oh yeah, this is being overdone. They quoted them in it. Versus we have a randomized control trial now, Dr. Gahari's from last year, which was on posterior tongue tie and bottle feeding with a computerized nipple. Because previously with these other ones, they said, well, nipple pain, that's like maternal, that's just subjective. Like that doesn't matter at all. Like mom's feeling pain, that doesn't matter. We're not going to even talk about that. But this is a bottle that gives computerized data, and they showed huge differences. Scott's seen that with ultrasound. Yeah. Donna Getty's 2008 did the ultrasound study showing that, like, okay, it's limiting the posterior mobility, or the actually back of the middle of the tongue, but anyway, and so they can't breastfeed as well. And so
Kathy Jenna may have showed them the images of the ultrasound too, because she's
but they didn't put any of that in there. So I mean, Scott had an article back in 2016, 2017 about aerophagia-induced reflux, which is helpful. And then they put like in quotations, oh, some people think it could help with reflux or it might help with constipation. They linked my article. So that was, I guess, my contribution to the piece, which we got some nice web traffic. Thank you, the New York Times. Got a few people visit the website. But yeah, Guilleminault, yeah, some people put in there frequent phenotype of, that one's helpful too. There's lots on pediatric sleep apnea. You know, Guilleminault is the father of sleep apnea in general. You know, there's tons in there. Like there's lots and lots of articles you could point to, especially now. There's more and more every day, it seems. We had one in 2020 on speech, feeding, and sleep showing improvements.
Yeah.
But that's what's hard about it, is that it's not like every kid's going to improve a speech. They might have eating and sleep, but not speech.
And that's what brings you back to the risk benefit ratio.
Yeah.
You never know.
That was brought up earlier. It's like, well, they actually sat there with me and heard my big spiel on this is all about risk versus benefit. And when we talk about surgery, talk about medicine, we're always looking at this ratio of risk versus benefit. Your child is coming in. I'm not taking you off the street. You're not being screened.
Yeah, you came to us.
I have a biased population, which I told them. And when I tell parents who ask me these questions, do you cut everybody that's coming in here? It's like, no, but I'm going to have to qualify that, because if you're coming here, you have some sort of symptom and an issue. And if you're being worked with, you know, as a team approach here, you're being evaluated by some sort of therapist, whether it's a lactation consultant, feeding specialist, the speech, body worker, or whatnot. We're all kind of looking at these pieces of a puzzle and coming up together with a diagnosis and a treatment plan. Then we're circling back to risk versus benefit. And yeah, this is not a new procedure. The use of lasers is not new. The use of lasers in my practice, which I tell them is not new, something I've been doing for a long time. Do we have issues or complications? Yes, they're very uncommon, and we kind of list them. After they left my office and whatnot, they kind of came back to me. It's like, how come we don't really talk about oral aversions as a common thing? So, because it's not common in my practice. So I don't sit there with a consultation and list everything that could possibly go wrong, but I list the things that are more common than not, including that, you know, we see feeding that's going to be up and down in the beginning. It takes a while. It's a process. Infection rates, you know, in my practice are basically zero. We talk about reattachment or scar tissue, and that's very low, but we all have protocols, and those protocols evolve. But true complications, they're reported in the literature. They're rare. In my own experience, and I say I don't speak for everybody, but I'm telling you my own experience in my practice, it's very low. And I just don't, you know, do the surgery and send you on your way. We have follow-up. If I can see you in person, I'd love to see you in person. It's not easy for people to do. So at least we're following on a weekly basis, you know, for at least a month or so. We try to have longer term follow-up. And I don't hear about the cases that are doing well, or sometimes I don't hear about the cases that aren't doing well. And
that's hard.
You know, it's not easy.
What do your consent forms look like, both of you? Do you have consent forms with all of the?
Of course, yeah.
Is that something that you would be willing to share? Well,
video is part of the consent process. And so we have everyone watch like a 15-minute video. It's on our YouTube channel, Alabama Tongue Tie Center. You can watch it. It's called New Infant Video or something like that, New Parent Video for Infants. And it has the stretches afterward. And it talks about all the complications and risks and benefits and what's going to happen afterward. And feeding might get worse for a time. And in the article, it didn't say how long was the feeding worse for. Is it worse for like a day or two or longer? It's hard to tell. The one girl, they said, oh, she still can't do solids. Well, I wonder if the tongue tie grew back because they didn't do any stretches. They were dehydrated and then it got worse. And that's, I think for me, the biggest risk or biggest complication is reattachment. And if the stretches aren't done with enough pressure in the right location, the right duration, they're not followed up on, you can do everything else perfect. You can do perfect assessment, diagnosis, perfect treatment. But if they're not checked properly, you know, and they're not followed up, then you're going to see problems afterwards. So
that's exactly what I said. It's, you know, word for word.
Wonderful. I know Dr. Kevin Boyd is joining us, and Dr. Milton Givelis, did you want to say something too? I know you're on as a panelist, but I don't know if you meant to be. but we'd love to hear from you as well. I know Dr. Boyd just jumped on too, so no pressure. I didn't know if you meant to come on to share, or you just wanted to listen, but you're more than welcome to come off mute and chime in. But Dr. Boyd, why don't you chime in and give us kind of—
Yeah, this is like smack dead and every kid in Chicago is out of school for the holidays, and I'm short staffed by 3 people, so I'm going to do my best. I really think I've been following this not real intensely, but I guess generically what I'd like to say is that if Dr. Siegel and Baxter, and Dr. Gavelis are the 3 experts here that I know of, know way more than I do, but I always preface whenever there's a controversy, there's going to be a controversy, and anything to do with tongue tie or lip tie is not. This is a topic that's not without controversy. I preface every conversation I have, and that because I don't treat this, I don't diagnose it. I assess risk because I'm a dentist. I do risk assessment for tonsils. I don't take them out. I don't tell ENTs what to do to take them out. I just assess risk. And I don't know. I didn't read the article, but I just, I think it's really important, especially from Richard and Scott and Milt, is that they, in their retort to this or whatever, look, this is not a non-controversial issue. It is. And the evidence is not huge, but those 2 Stanford studies that I sent those papers out, as far as that's all you got to have. Those 2 papers say it all for me. And I don't know, that's all I have to say. That's my 2 cents.
We appreciate that.
I use those 2 papers as a cornerstone as well, to justify, why we're doing this when you come in with a symptom, but also looking at the long-term aspects of untreated ties, especially if you're having some sort of functional symptom. So, it's kind of difficult to dispute those articles.
Yeah,
we're going to put those in the chat shortly.
I guess the article is mostly focusing on babies. And so we have some good evidence for tongue ties. I think you're pretty well covered there. And if there is kind of like a board complaint ever from someone who's listening, you just point to the articles or even the AAPD guidelines if you're a pediatric dentist, and they pull that up and it says it can help with breastfeeding, and then they dismiss it. Just like it said in the article, with the other guy said, stuff happens. The dental board knows that. The medical board knows that. We're not doing this with no oversight. Lip tie, there's a few articles that mention it. There's not that many great ones. I wish there was better ones. But again, how are you going to piece out, okay, was it the lip tie? Was it the buccal tie? We had 0 articles. There was none on buccal ties. That's why I talked to Lisa Leahy and I talked to Robin about this. Like, we got to do something. And it got Sarush involved too. And he's like, we got to have data. So that's why we sent out this research, got IRB approval, did a huge Facebook, basically an email listserv survey, had 466 providers from 15 different countries, just got it published in November. If y'all haven't seen that, it's open access through Journal of Oral Rehabilitation, but basically give a buccal tie classification system, say, hey, we have to have at least something to start with. You can't just jump straight to a randomized control trial. You start with case studies and you build up. Retrospective cohort study, prospective cohort study, go to randomized control trials, systematic reviews, meta-analyses. So you can't just, everyone wants to say, oh, we got to have level 1 evidence. Well, you can't just have that. But what we do have is case series. There's a prospective cohort study I did, prospective cohort study Bobby did, and a randomized control trial Bobby did, and others that were more frenotomies, like a snip or a clip instead of a full release. But Bobby's latest one, the randomized control trial, was with light scalpel, and he was treating only posterior tongue ties, not anterior, and saw a large benefit there. And so I think we do have enough to stand on. At least we have something with the survey of providers versus, so if someone says, oh, buccal ties don't cause a problem, like the clinical consensus statement that they quoted in the article from 2020. A funny story about that, Jonathan Walsh, who's the second author on there, he was invited to a lecture at Michigan Academy of Pediatric Dentistry. Dr. Zaghi and I were both there. Zaghi went first, Walsh went second, I went third. And after he heard everything, I said, what do you think, Jonathan? Because he was like Mr. Anti-tongue tie, right? This is Johns Hopkins ENT. I said, how many of these, we had dinner with him twice. I said, how many of these do you do a week? He's like, maybe 1. So it's like totally different. You know, we're doing like 10 a day or something. I don't know. And so he doesn't do, he does like these robotic surgeries where they'll take out someone's thyroid through their lower lip. Like that's what they get excited about. You know, for the ENTs, like this is just like a simple snip. What's the big deal? But anyway, afterward, he said like, okay, I can see like how this is working. He said, I'm not denying it works. I can see it works. He said, the problem is like, we don't have a way to explain how that works with like modern medicine. I said, it's about the fascia, the connective tissue, like parasympathetic response, the vagus nerve. He's like, yeah, but like, we can't quantify that with a study. I said, well, that's your job. You quantify it. I said, well, what do you suggest I do for Monday on my patients on Monday? What should I do? Should I help them or not treat them? He said, no, clearly it's working. What you're doing is working. Treat them. I said, okay, I have the blessing from Mr. Anti-Tongue Tie to treat these patients. And he showed his ignorance in some other ways I won't go into, but just you don't have to chew your food to swallow, like things like that make no sense at all. And that's who these people are. We have a panel of experts that came up with a consensus statement that buccal ties should never be treated, tongue ties do not affect sleep apnea, all these things that they've reached consensus on, which was basically confirmation bias in a big room. And they did not invite Sarush there or Bobby Gahary because they're not pediatric ENTs. But anyway, it's just yeah, it's one of those things we'll battle for a while. But I think again, the moms are seeing the difference. They're telling the pediatricians. We had a bunch of pediatricians refer to us last year when we used to have 0. So I think it is shift. The tide is turning slowly, but I think ship's up riding, whatever metaphor you want to use. I think the future is bright. I don't think this is the end of the world here. It did bring some positive attention to it. At least I'd say, any news is good news, I guess, in some respects. Sadly, it's at Scott's expense and at Melanie's expense and a few others. But like I said, I do think it'll blow over soon. And
I'm not concerned so much about it blowing over. I don't think it should blow over. In fact, I'm hoping that it might get a little more intense.
Well, that's
my onus is on us. This is our opportunity. This is an opportunity.
So my wife, you gotta look at this as a positive opportunity here.
Yes.
Yeah.
Now,
what they meant for evil, we got to turn for good, basically.
Right.
Yeah, and I think with your leadership, if we can maybe provide some FAQs, so doctors, who are doing this, or airway dentists, just to have the information, and this way the parents can make an educated decision, knowing the risks involved, knowing the risk benefit ratio, so they're fully aware and understand. Our heart goes out for that mother and that child. Of course, we're healthcare professionals, so we're empathetic, and this does happen. But I don't know of any surgery that doesn't have any risk to it,
so who's going to respond? Is there an organized, who's going to respond to this? And can we review your response? We should get something done fairly soon, but
yeah,
and the people who should respond, I mean, really, Richard and Milt Gavalis and Sarush, it really should be the people, doing it, the surgeons, I feel. I'm maybe a myofunctional therapist giving the reason why it contributes to orofacial myofunctional disorder, which is part of all malocclusion. Excuse me, you heard me, right? There's no malocclusion that doesn't have OMDs, and they're heightened, with the presence of a tongue tether. So I just boy, you guys get a good response, and please let us review it before you post it. Because I think
Robin said she was going to start working on it right away. She's like,
yeah,
she
already
have
like
something ready.
6:30 this morning,
Yeah, she texted me early. She hears about these articles before anyone. I don't know how she always gets them, but anyway. Yeah, it's interesting. And she had a response from because there was something with the New Jersey pediatricians. There was something with the Michigan pediatricians last year, the Kentucky ones. They're kind of getting these groups to get together and write these things. So she has a couple of rebuttals already written up, and so we can put those together with some other ones. And yeah, maybe
I'm sure you guys are going to do a great job.
Well, like the
maybe
biggest
through
issue
ICAP
here,
or something, put something behind it,
Right. That's and I know there's even I think Jen Toe keeps texting me. I don't know if she can speak here at all, but there's a lot of lactation, because this was really about babies. This article was all about babies. They really didn't talk about, you know, older kids, or even though we discussed airways, we discussed these things. It was really about the business of, you know, cutting babies and how do you respond to that. So
dentistry makes money, like you said, like doesn't, you know, do you do a lot of tongue ties? Yeah, you end up doing most of the ones that come to your office because they're
Right.
going through several levels. Like the endodontist, does an endodontist do a lot of root canals? Like it's the same question in my mind. Like, of course, the endodontist is going to do a lot of root canals. Maybe occasionally he's not. He's like, hey, you need to get it extracted. But like, you know, if you're doing root canals all day and someone comes to you with a, you know, a sore tooth, but I would never go to the endodontist and say, hey, can I have a root canal today? Oh, okay, what tooth is hurting you? I don't, just pick one. No one's coming.
Unfortunately,
my baby, Scott.
I've got to get back in my clinic, but I'd like to say, I would encourage you guys to stick with ankylosing and stay away from lip ties, caries, and baby, you know, front upper incisors. It's the only published thing by Kotlow. So I would stick to ankylosing and just leave the buccal ties and lip ties alone. This is all, as far as I'm concerned, this is what people want to know about. There's literature going back 100 years talking about tongue ties.
Oh yeah.
You know, so thank you for letting me be part of it. I'd be happy to review anything. You know, and you just please let me review a manuscript before you post a letter to the editor. But whatever, if you can't, just do it. I'm confident you guys will do a great job. Okay, good luck. I gotta go.
Good to see you,
Thanks,
Kevin.
Kevin.
Yeah,
Thanks, Dr. Boyd. Thank you. And I'm happy to put together a master class with the top surgeons, Dr. Baxter, Dr. Siegel, Dr. Zaghi. I would be happy to do that if you're all willing to share your expertise on getting a little bit more details into the risk ratio benefits and maybe some of these consent forms, just so we can spend more time. This was kind of a last minute. We didn't know we'd be doing this morning, and we had over 100 people on this call last minute. So I know we're going to get this out on our Airway Health Meetup group. We'll put that in the chat. It'll be recorded there. It's not going to be on YouTube yet. I just wanted to have a safe space in a private setting where we could really talk about this as dental professionals. And I think there will be time if we want to make this, you know, more public YouTube video. And anything that you want to share, Dr. Baxter, Dr. Siegel, if you could email me, I will forward that to the people who registered for this call and also on our social media platforms, so everyone can have the benefits, because knowledge is power. And I really appreciate your time. I just want to make sure, Dr. Siegel, did you want to have any closing remarks or anything?
I mean, you know, I think the article brought up some valid points, you know, about maybe some of these are being overdone, or potential laser companies being unethical, like the tequila sort of
that
thing.
Was bad. They should not have named it that. Tequila and tongue ties.
Yeah. And I don't know what, it must have been another laser company, because I never heard of it. Right.
So in the article,
you know, the ones that we deal with are really, you know, bent on education and science and the research and experience behind it. But, you know, addressing, you know, how maybe some practitioners are not doing it the right way, and it gives the rest of us a bad name, who are really in the trenches trying to do no harm and get good results here, and trying to take care of the whole dyad and the family involved. You know, it's not just about cutting a tie, you know, as the title says.
I know.
Yeah, and I'm going to give a shout out to Light Scalpel. They do a wonderful job with their education. They have a wonderful faculty. So you may want to look at their website. They have a lot of resources as well. We have a lot of follow-up to do to offer you that information. But yeah, that's a great point. You know, what is it? Tequila and tongue ties? I don't know. Yeah, I mean, it doesn't help anybody.
Here's why though. Here's why. Here's what happened. So there's Bourbon and Baby Teeth is this huge conference, right? And so there's like, they're trying to play off that. So it's like you go to Kentucky, you get bourbon, and you like learn baby teeth. There's another one, Dentaltown had called Beer CE. And so like you have events at night, which the medical doctors do too. They'll have receptions at night, but it just sounded bad. I'm sure someone thought it rhymes, tequila and tongue ties. We'll do it in Arizona or whatever. Nothing against BioLace. I had an iLace for about 18 months, a little diode. I don't know them any more than that, but you know, it was unfortunate naming it that. So I think Breathe and Thrive is a better name for a conference like the one in February that Scott and I will be speaking at in San Diego. We want kids to breathe well, and we want them to thrive. You know, it's pretty simple.
Thank you.
But you know.
Any last words of advice for practitioners who are going to be answering to these parents tomorrow, just in a nutshell?
Keep your chin up and, do what you think is the right thing to do, and just be open and honest. And, this is.
We have the studies. It's not that we don't
Right.
have any studies. And I put that meta-analysis that came out last November, that they analyzed over 5,000 studies, and they ended up with 39 that they looked at, and shows a couple of things. One is ankylosing and how it affects feeding, as well as the mental state of the mom, and what, traditionally they've been getting as no answers. And this article has one person that supposedly ended up with a feeding tube, but it doesn't mention the hundreds, if not thousands, of babies that we've taken out of feeding tubes.
That's true,
I
Mel.
know that every single one of us
Right.
has seen babies that are 3 months old, 4 months old, 5 months old on feeding tubes.
Yep.
And some of them GI tubes, some of them start with an NGI tube. And at least in my practice, and I know Scott's practice, and I'm pretty sure for your Richard too, there's a whole number of them that we have seen. That one of them I just did last year, and went to the physician the next day, took a whole bottle that couldn't even swallow before, and the pediatrician says it was going to happen anyhow. It was just a matter of a chance, and we were just
Unbelievable.
in that particular one. So this is so one-sided. When I was reading, I go, you got to be kidding me. But it happens every few years. They come up with one. I know they asked Bobby to be a part of this too, and I know that he posted that he didn't accept to, because he knew it's going to be kind of one-sided. But I agree with you guys, and the same thing with Kevin, that let's use something negative, publicity, and make it positive. The only thing that I know from things that I see in perio and even anything that is considered even slightly controversial, what happens is you give your answer, you put something together beautiful, and then you try to figure out what the heck they stuck it, because even if they put the answer, it's not as publicized as the original article that caused the stare.
Right.
So don't expect to show that article and right under it with big letters is what we are going to say, or anybody's going to say. But that's what we deal with. All we got to do is keep doing what we're doing. You guys are amazing at producing not only literature, but eloquently talking about those things. And all these moms, even when they ask about studies, I go, if there was a bad procedure that we're doing to enrich ourselves, and you would go into social media, it would be really all bad comments from moms and everything else, instead of what you see in social media that brings more people in for what we do. So thank you for all you're doing. All I can say is we're going to keep what we're doing. But yes, we have to support what we're doing. If we can find literature, if we can produce literature, but no matter how much literature you produce, the people that are part of this, they don't care about that. And don't think for one second,
they don't care.
What we're going to do is going to change their minds.
They don't
We
care.
can do as healthcare practitioners is to empower. I'm going to take Dr. Dave McCarty's route here and empower the patients, empower ourselves as practitioners, and that'll just really, knowledge is freeing, and we can really step this, this whole platform up a notch through empathy, as Dr. McCarty says. And I don't know if he wants to join in here and comment on that, but I'd be happy to give him the platform for a moment as well.
And Sarush did a little update with the Breathe ambassadors the other day, but he said all knowledge passes through 3 stages. First, it is ridiculed, then it is violently opposed, and then it is accepted as self-evident. Like, oh, we knew the whole time tongue ties work. Yeah, of course, everyone knew that. So we're getting there. We're getting there.
Right.
Also,
that
Scott has a couple hundred 5-star reviews. Scott has over 1,000 5-star reviews. I'll check. There's 1 1-star review, and there's 1 3-star review. The rest are 5,000. Check your local pediatrician reviews. See what they say.
Exactly. Hi, Dr. McCarty. I just wanted to know, this is right up your alley about empowerment. So I just want you.
My goodness,
the article.
I've been enthralled with this entire conversation. I want to thank the entire panel for being as forthright as you are. To me, this boils down to I see this as the narrative of the story of people who feel disempowered by the system. So if someone with a white coat says do this, and a bad thing happens, and they didn't feel like they knew what was going on, so that risk benefit ratio didn't happen correctly, that narrative is very powerful. And the rage of the indignant who felt like they've been misled by someone in a white coat is very real. And I see this again and again. It doesn't matter which treatment we're talking about, you know, whether it's tongue tie or whether it's a CPAP slinger or somebody pitching an oral appliance. If it's done indiscriminately by a profiteering practice, that's bad for all of us. And so you can frame it as a hit piece, but you can also see this as there are practices out there that are kind of doing this as a rubber stamp thing, perhaps. I mean, I've seen it with every other treatment, and so it must be happening. So I'm feeling that the people that were harmed in this story, they feel like they need a voice, and the writers of the story somehow felt like that was the most prominent thing they needed to project. So somehow we need to understand that there is a narrative out there where people in white coats are misleading folks into treatments that they don't need, and we need to help them protect themselves against that, you know?
That is true. It goes this way. It also goes the other way. We see, I'm sure you guys will see more cases where the child was told there was nothing wrong. We had one, he was almost 3 years old. He had been to 70 different healthcare providers, said there was nothing wrong with him. He was not talking. He could never take a bottle. He couldn't breastfeed. Mom had to syringe feed him for 12 months, right? Couldn't do solids, sleeping terribly, had a to-the-tip tongue tie that no one picked up. Mom was going to sue, sent lawyers up to my office to talk to me about it because I did the procedure and he started talking the next day and they're like, what happened? And so mom wanted to sue all those people. I don't think anything ever came of it. Conversely,
my goodness. This is the thing that can't be unseen.
That's what should be on the news, but instead it's not. Or all the moms being gaslit by the pediatrician saying, oh, we're fine, they're gaining weight, just give them some formula. It doesn't matter if it hurts. Then the other thing about the money aspect, man, like we have some people with $1 million workup. They've been in the hospital, right, inpatient in the intensive feeding program for weeks, sometimes months. They can't figure out what's wrong with this child, doing all these invasive surgeries on them. They come to my office, we do the tongue lip tie, and they get better like the next day. Like it's not a coincidence, like Milt said. I mean, it's unbelievable. That's not always, but like often that's the case. And they get off the G tube, off the NG tube, whatever it is. Those are the stories that I wish were heard by people. There was one positive New York Times story on tongue ties several years ago. Is the boy who started talking after he had the tongue tie done. That made the rounds. I was like, oh, praise Jesus. There's one article they wrote in the last 10 years was positive on tongue tie. But yeah, it's going to happen. But like you said, there are patients out there that have been hurt by the procedure. I'm sure I've done some. If you do enough of them, you'll see, there's some people that the baby wasn't ready for it or whatever the case was. But the other factor is they drove from 5 hours away. And it's like, well, they haven't had all the body work they could have. Ideally they would, but they're from middle of nowhere, Alabama. They don't even have a chiropractor in their town. What that's to the tip. What am I going to do? You have to help them out. So anyway, it's complicated. I think that's the take home message.
No,
but
and
if Scott's encouraged and Scott's okay, then we can all be okay.
Well, listen, Dave's point is, very valuable because you want to validate the people who've gone through something bad or feel that they, were slighted by the medical community. And at the same time, circling back to risk versus benefit and empowering families. So when a family comes in, I said, I'm giving you the information so you can make the best informed decision for you and your family based on my experience and what is out there currently. I don't push somebody to do something. That being said, bad things happen in medicine and surgery, and you can't always predict it. We're trying our best to try to help that happen. The unfortunate part about this, type of article is just one-sided. So you get that bias that's so significant and negative, but not, allowing us to have that voice. So we have to have that ability to be able to share that, on a platform. An op-ed, I don't know, like Milt said, it might not get enough exposure, but, we have to figure out some other ways of doing this.
I kind of prefer to look at, rather than a hit job, I prefer to look at it as giving voice to those who have been harmed by a system that has reduced this to a label and hasn't treated them like a human being, because that's clearly happening. And if we all recognize that, it's not the procedure, it's how this is presented and the rollout for our patients, if we make it humane and we can unpack that complexity responsibly, then this type of indignance doesn't happen anymore.
Exactly.
Well, I'm so thrilled that everyone is here today, that we're discussing it, that we're bringing light to the situation. There will be good coming out of this. We will provide some resources so we can all come together. Together we are stronger. And I really appreciate everyone's time today. And sorry, Dr. Siegel, that you kind of got the short end of the stick on this one, but we know your intentions are great, and we know how many patients you've saved over your career. So thank you for doing what you do and continue to do so. Thank you, Dr. Baxter, for your time. Thanks, Dave, for jumping in.
Yes,
Thanks,
sure.
everyone.
Thank
Thanks,
you.
Dr. Milton.
Thanks, you guys.
Thanks, guys.
Bye.